you are into politics because of your desire to serve your people and contribute genuinely towards the development of your place, you must have the spirit of a sportsman.
Amazing how much time and sacrifice it takes to achieve great success, from working systems to thinking heads, concept to execution. Only a resilient, revolutionary, self-sacrificing genius could lead this level of transformative change. Good systems work like a miracle, like how a child in Agwaja with a rare condition of urethral-cutaneous fistula got treated and cured for free, or a woman in Imbisi with the issue of blood who got a free hysterectomy after 7 years of non-stop bleeding so that she can live a normal life again. Such is the doings of the Imo State Health Insurance Agency.
When I came, I reorganized the health insurance agency and then started encouraging them. I spent my first 2 billion naira repairing 305 private health care centers in Imo State to make sure at least they are in existence.
We have 305 wards in Imo State, so health centers in each ward had been renovated.
So we now did a comprehensive investigation and assessment of our healthcare facilities. Most of them were like mortuary, death traps.
When I came in, apart from that renovation, he wasn't satisfied. Like I told you, he had gone round. And he said, no, we're going to revitalize those health centers. So we partner with 1 or 2 donors. The governor is ready to match them with whatever counterpart funding that is needed. And he brought up an Imo model, the model for all the health centers in the state.
We now entered into agreement with OEMs, equipment manufacturers like Canon, General Electric, and all that, and brought in some core investors to buy those equipments and lease to us. So it means that in the 27 local governments, we will have 27 quality general hospitals, well equipped and well staffed. In the 305 electoral wards, we will have at least 305 quality health centers that when the case is given to them and is beyond them, they refer such patients to the general hospital. And then we must strengthen our university teaching hospital and our specialist hospital for referrals as tertiary health institutions.
The Imo State government is aiming to enroll over 2.7 million residents into its health insurance scheme. The target is part of ongoing efforts to ensure universal health care coverage across the state.
The 300 wards of the state, we have been implementing health insurance since 2023.
The cost of health care, to provide adequate health care to your people, is very, very expensive. So what did I do? I queued into the insurance program. And my target is to enumerate at least 2.5 million Imolites into their net, and then with annual payment of 15,000 naira a year. The whole idea is to make sure this 15,000 naira will be able to treat you from January to December, no matter the sickness outside cancer.
15,000 naira per person per annum. Literally what we don't cover is just cancer management. Virtually everything is covered.
We have a premium of 15,000 per year for each person in the family or in the community. The insurance is offering every except cancer treatment.
The woman from Ayazumbise approached us. Initially, she wasn't enrolled, and she came to the office. She told me that she has been bleeding for 7 years. 7 years, constant bleeding non-stop. Jokingly, I told her, Madam, we will not be able to cover you. She made a statement that, okay, let me just go home and die. So I now told her, no problem, we'll be able to protect you. The surgery was done, a hysterectomy was done for her. The day she was discharged, she was so happy and so grateful. Just this morning, we had an amputation done at Imo State Specialist Hospital. It's a gangrenous foot for a child that had an accident in December, but because the child is an orphan and both parents are dead and there was nobody to take care of the child, so the case got complicated. The plastic surgeon has reviewed and the orthopedic surgeons have all made the conclusion that we have to do amputation for the child. So the agency is paying to the last kobo on that. That's as difficult as amputation. We've done spinal surgeries, as expensive and difficult as spinal surgeries. We just authorized payment for a medical doctor who had multiple fractures and has been on admission for 2 months. The doctor is from Isu local government. I wouldn't want to disclose his name, but he is from Isu local government and he has just been discharged some days ago. So on this program, We have had a lot of cesarean sections. And the beautiful thing about the program is that the implementation is both public and private facilities. So it doesn't necessarily mean that the implementation is only in public facilities. As expensive as one of the top-notch healthcare facilities here in Owerri that is popular for obstetrics and gynecological cases, we have done over 200 cases there. So cesarean sections are covered, consultations are covered, meeting your specialist is also covered, abdominal surgeries are covered, orthopedic surgeries, ENT surgeries, eye cases are all covered.
We've done more than 3,000 cesarean sections free of charge. We've also had some neurosurgeries done without them having to pay anything. You know, surgeries that would have cost them millions of naira. Just with that, they're 15,000. They're able to access that care.
The medical doctor we just authorized his payment this morning that has just been discharged some days ago. His bill is 2.1 million naira. He was on admission for 2 months and the agency took care of the 2.1 million naira. The least spinal case you can get here is above 3 million naira. Cesarean sections in private facilities here in Imo State ranges between 450,000 to 600,000. And I am telling you, we have done over 2,000 cesarean sections.
There's no wealth without health. Every Imo civil servant that is properly insured under this program, apart from cancer, will be treated of any sickness, will be taken care of, including routine medical checks.
The state was created in 1976. From 1976 to about 2 years ago, no civil servant in this state can access health services without paying or selling the property he or she has. But today, we have enrolled every civil servant in Imo State into the Imo State Health Insurance Agency, and they have commenced access since November 1, 2023. On that program alone, we have managed about 17,500 cases, including amputations, CVS, all forms of medical and surgical interventions. So no civil servant in Imo State today can access health services by paying. All of them are all insured and all paid 100% by the governor of Imo State. And currently we have just enrolled every pensioner in Imo State, which is also another vulnerable population because of their age, they are considered vulnerable, all paid by the governor of Imo State.
The formal sector had been covered, the civil servants, the pensioners, and then the governor says there are the main people, the grassroots. So far, for the past 2 weeks now, there has been a massive enrollment. So the target is to get 100,000 per local government. And we have 27 local governments. So that's 2.7 million people. That will be the highest in the whole of sub-Saharan Africa.
We will deploy both MIR machines, all the sophisticated machines in Imo State. It means in the next couple of months, not only that you do tourism here, it will also attract medical tourism. Because one thing we must stop, which made me to go into a memorandum of understanding with Indian doctors. Our Dental and Medical Council has approved 42 Indian doctors to work in Imo State. And what would they be doing? They would teach in our medical schools, work in our hospitals. The midwives and nurses that will come with them will train our own nurses too and train our own midwives in the next 24 months before they leave. That way, we would have graduated sufficient technical manpower to man all these facilities. And we are doing that just to help our people. Because it is funny that a country like Nigeria still goes to India for kidney transplant, still goes to India to check fibroid, things like that. But you know, 25 years ago, we had Indians coming here to look for teaching jobs. So this 360 degrees reverse. What is responsible for it? So we must think for our people as a government.
Whatever it will take to take our healthcare delivery system to the tops, that's what the governor wants. You see, he's trying to build back the public trust in the health sector.
Imo is not just becoming something new, it is becoming something big and beautiful. Imo, a state on the rise.